Well, hi everyone, it's Pete here again for the Pain Toolkit, and yes, we are back with another Q&A. And well, weather has been, as I'm not going to become a weather presenter, but it's been super hot, super scorchio. But hey, listen, we've got some fantastic questions. Thanks very much for everybody sending in the questions. It's much appreciated. If you've got any for next week, please send them in. Listen, as you can see, guys, that we got another guest with us today, Dershnee from South Africa. And I'll tell you what we'll do, we'll just do a quick look, spin around and just introduce ourselves. So, as we're all, myself, Dave, and Keith are gentlemen, we'll let the young ladies go first. So, Dershnee, do you want to introduce yourself and tell us briefly about what you do?
I like the way you call me a young lady, Pete. I love it. So I'm an occupational therapist. Um, and yes, I have a special interest in pain, in helping people with pain, teaching about pain. It's kind of my obsession. And I've been doing that for almost 30 years now in South Africa, constantly looking for new ways to help people with pain. Um, so I have a podcast. I teach courses on it, and obviously I also do see clients and patients with persistent pain. So yeah, it's my obsession basically.
Nice. We're glad you're obsessed.
Yeah, very obsessed. Yeah.
Keith, can you just briefly introduce yourself?
Absolutely. I'm Keith Meldrum. I live in Kelowna, British Columbia, Canada. So for those not in the North American part of the world, British Columbia is the westernmost province, and I live in the southern part. And yeah, I'm a person who lives with pain, but more importantly, I'm a almost 1 year retired civil engineer technologist, and could be traveling across the country, Canada, here in a week. And in my free time now, I do stuff like this with Pete and other advocacy work. So always a pleasure to be here, and very nice to meet you in person, almost, Dershnee.
And last but not least, Dave.
Yeah, so I'm another person that's living with pain, part of the Pain Toolkit Academy with Pete and Katie, and also one of the people behind the scenes at our regular conferences. The next one's coming up in October, I believe. So sign up for that one. And if you're lucky enough to sign up for it, you'll even get to hear me speak at it.
Yay.
Well, thanks very much, guys. So let's crack on. Let's get on to the first question. It's from someone called Helena, who's a healthcare professional, and she it's one of the questions left over from last week, and we never got round to doing. She says to have a better understanding of people's experiences, how can I meet them where they are at? I'm going by the commas here, so I'm not sure if it's reading right. To have a better understanding of people's experiences, how can I meet them where they are at? And what five pieces of expertise will I need to know to learn to support them? I like that one.
Mhm.
Yeah, I thought it was an interesting question.
It was to
Um,
start us off.
yeah. So I don't know if you guys are okay with me sort of starting
Yeah,
the
go for it.
answer.
Yeah, go for it.
Absolutely. Yes, please.
So this might sound a bit controversial, but I don't think it's about expertise. I kind of read that and I thought, five pieces of expertise. Actually, I don't think that's what this is about. I mean, I understand her question, but for me, to really answer it, what I would say is it's not about expertise. It's about understanding the pain experience. And
Yes.
for that, it's about what can we build on and improve on as healthcare professionals, right? And what I find to be really, really important and so I'm very, very clear, this is my own experience and my own opinion from my clinical experience of working with people with persistent pain, is I find that the therapeutic relationship is a really important component to that. So
Mhm.
building a trust relationship with your client or patient, and then communicating well with them. But one of the key things about communicating well with them is listening. Now, as healthcare providers, we are taught listening from the time we're undergrads, from the time we start this process as becoming a healthcare provider, we're taught listening skills. But I can tell you, up to today, I still feel like my listening skills are not great, and I'm almost qualified for 30 years. And the reason that is because listening is a really hard skill. You've got to practice it. And one of the hardest things about listening is that you've got to be in the moment with the person. And that's where I think we fail as healthcare providers, because often what we're doing is there's a gap between our understanding as a healthcare provider of the person's pain experience and what their lived experience of pain is, of what they're actually going through, right? There is that gap. And so the issue is that people don't understand that there's a gap, and they assume they understand what someone's going through. And as a healthcare provider, actually, you can't fully understand that because you're not living that person's pain experience, right? And so what I try and bring it back to when I teach about pain and when I explain about pain to healthcare providers is bringing it back to the fact that we have this gap between what we understand to be the pain experience and what the person going through the pain experience is living, right? And how do we meet them there? Well, actually, we kind of have to really understand that what we think doesn't matter. It's about what matters to them, right? And it's also about what they think is important. And it's about understanding that, and this is what we do as healthcare providers, unfortunately, is when we sit with someone with pain in front of us, immediately our brain goes into the pain science. And we start thinking about the physiology and the symptoms, and we're kind of ticking boxes in our head going, oh, they've got that symptom. I wonder if it's this, and is it neuropathic, and is it nosiplastic, or what we're trying to draw all the lines, right? And actually listening to somebody requires us to let go of that and to actually be fully in the moment and pay attention to that person and absorb that pain experience, right? And in doing that, we allow the person to drive the process. We allow them to actually move us forward. And so, what I would say the most important thing for helping somebody with pain or the expertise that you need to learn is the listening part of it, but it's also about understanding that the patient or the client needs to become your partner. And that person needs to become the leader. You are not the leader in this relationship. And I find that healthcare providers find that very difficult to let go of because we are not taught that way, unfortunately. Yeah.
Okay. Thanks, Des.
Brilliant.
I remember someone pointed out to me years ago that about the listening skills, and they pointed out very simply the fact we've got two of these and only one of them. So I put it if you're listening to us on an audio and pointing to my ears, and now pointing to my mouth, we've got two ears and only one mouth. So it's and a little saying I learned years ago: learn to listen and listen to learn. And I think that's so important. And I don't think there are some people with pain who want to learn about it, who quite enjoy learning about the pain science. But I go back to my driving school days. When I was a driving instructor, and the role was we called it the very first lesson was like a controls lesson, like explain how the how the car worked and all that. But you could look especially the younger people, look at their eyes, I don't really not interested in this, friend. I want to get going, And I think most people we're paying are pretty similar as well, is that they just want to get on with their lives in some sort of manner, and to get bogged down in all the technical stuff, nerve, this, that, all that, and whatnot, all the pain science, you just say. I don't think a lot of people that really that interested in it. They just want to sort of their pains become a problem for them, and they just want to get on with their lives, So it's about how we do that. And I liked how you said it's about working. The person with the pain is leading the conversation rather than the healthcare professional. But that's where with people with pain, we need to become that. Remember that, and because at the end of the day, it's like going back to the drivers, the driving thing. They're in the driving seat. They've got to learn be in the driving seat because they're learning something that will give them mobility and freedom, etc. And it's the same thing with learning how, similar to learning how to manage pain. It's about being in the driving seat. You and the healthcare provider or healthcare professional is just there to be the guide, and show them how this is guidance on how they do that. So I'll hand over to someone else.
Got a couple of quick thoughts, but Dershnee, that was brilliant. And I loved how you started off with it. It's not about expertise. And I just love that because I think right out of the gate, a lot of healthcare providers do want to, it's part of training and all that, but they overcomplicate it. But I just love what you said. And what came to my mind was I don't think there are five things. I think fundamentally it's about listening. One of the most important things is true and validation of people's pain experience. And a lot of people go through many years before their pain is truly validated. There's needles and stuff are stuck in them, but they're never told that this pain is real. Might not see it on a scan or anything, but your pain is real. And just everything that you said. So I mean, you said it beautifully, and it's that validation. And then I'm just always reminded, and I use this quote all the time, and these guys have probably heard me say it, but William Oxley was a Canadian physician back 1897, 1867 or whatever. He said the good doctor treats the disease. The great doctor treats the person who has the disease. You can't separate the two, right? It's the person. So everything you said, and you're an OT, and I think OT for the win. You guys are just amazing in your profession, and you get right to the heart of what people need, and it's about them and regaining function and what's important in their life. So beautiful. Thank you.
Mm-hmm. Yeah, agreed.
Yeah. Yeah, the listening bit is important. It's that active listening, isn't it? Rather than just listening to work out what you're going to say next. It's listening to hear what's being said, and also then paying enough attention so that you can read between the sentences. Where are the pauses? Where's the inflection? Because you'll pick up a lot from that versus just what they've said. And then from that, hopefully you'll be able to pitch your initial response at the level that the patient's at, because we're all going to be at different levels as we come to see a healthcare professional. And if I'm here and I'm getting information here, I'm going to go, there's no point. Back in when mine started, I was down here, my physio was doing a brilliant job, but she was giving me information up here. And I ignored it because I wasn't ready to hear it. So it's getting, I know you're going to tell me what I need to hear rather than what I want to hear, but it's got to be what I can understand and what I can take in my current pain self-management journey.
Completely. I agree with that. I completely agree with that. I can agree with you and Keith. I think it's fundamentally important that healthcare providers understand this whole concept of listening, paying attention, and actually how to do that effectively. Because I think that's where it breaks down, right? And that's where the validation doesn't happen, because they just jump to conclusions and they start handing out the tools that they've been trained to hand out. And I always say to my patients, I say, you can't blame the doctors and the healthcare professionals, because when people don't know, they just do what's available in their toolbox, right? And so if they've got a hammer, it's like that thing that they say, if you've got a hammer, everything's a nail.
Exactly.
That's exactly what happens. It's exactly what happens. So the surgeons are busy cutting and the pharmacist is busy handing out the drugs, and I try not to, I say to people, don't blame them. Don't be angry at them. If they didn't know better, they're not going to do better. But at the same time, it is on the onus of the healthcare provider to make an effort to learn. If you're going to treat someone with chronic persistent pain, or persistent pain, you need to make an effort to know more, you know.
Mhm.
And if you're not going to make an effort to know more, then you have no business in the space. And I mean, I'm sorry, that is a controversial statement, but like make an effort,
Nope.
sort yourself out. If you're going to help somebody know what you're doing, make an effort to learn. And if you're not going to make an effort to learn, then I don't want you in this space, because
Yeah.
persistent pain is a very complex area. It
Mhm.
has layers. You can't, it's not simple. You know, you can't just walk out there and go, well, I'm going to treat somebody with pain now who's persistent pain. No, it doesn't
Mhm.
work like that. But it isn't so much about, yes, it is about learning about pain and the science of pain. And I absolutely do that with my clients. I don't want to throw the baby out with the bathwater. I'm not saying that we don't do that with our clients, but it's exactly as Dave said. If you're coming in at this level and your poor patient or client is sitting here, everything is going over their head. You know, it's kind of
Mhm.
like sitting in that doctor's room where the doctor's explaining to you that you've got cancer and you've heard nothing past the
Right.
word of you've got
Yeah.
cancer, right?
Yeah. Yeah.
It's exactly the same. So yes, we do need to use pain science in helping our clients and patients understand what's happening in their bodies, but it has to be done in a very specific way, and it has to be done, like Dave says, at the right time for that person.
Yeah.
Yeah.
You know, and we often repeat that information because people don't remember that stuff. You know, it's stuff that gets repeated over time. But I agree with everything that everyone has said about it. Yeah.
Just
We
picking up
agree
on
with
that.
you.
I'm sorry. Yeah,
Mhm.
we do. Just following on from that, one thing I found really useful when I've been coaching others is at the beginning of the next session, ask them what they remembered from the previous session.
Mm.
And that will very quickly get you to their level, because the
Absolutely.
first session
Yeah.
you're
Yeah.
going to be doing this. The
Yeah.
second
Yeah.
session you want to get that oscillation down, and then you want to end up by the third session to be at the same level.
Yes.
And
Yes.
asking them to tell you what they remember and
Yeah.
how they understand it will, get you there a
Yeah.
lot quicker.
Absolutely. Agreed.
Brilliant. Yeah.
Yeah.
Love it. Love it all.
Okay. I'm going to move on to the second question. Now, this is from a person living with pain called Tony. What role does mindfulness or stress reduction play in managing his pain or my pain? What role does mindfulness or stress reduction play in managing his pain?
I'll just throw in a couple of quick thoughts here. So this actually, I think, does sort of Dershnee speak a little bit to. This is where kind of pain science and physiology can come in a little bit, because I didn't understand any of this back in the day. But your nervous system, if you can actually regulate your nervous system through mindfulness or relaxation, breathing, ways to reduce your stress, you can actually bring that stress level down, and that will have a net positive effect on your pain. Now, I never believed that. I thought it was a bunch of bunk and woo, and people were trying to sell me goods because all I wanted was a needle and make it go away. And I learned that my deep breathing was more effective than any needle I had ever received. So it's like you said, you can't throw the baby out with the bathwater. If you give them all pain science out of the gate, like you said, they're going to be like, I'm over here. But when you can explain to them how their nervous system works, there's parasympathetic, sympathetic, if they like those terms, or just fight and flight, rest and digest, all whatever it takes. But just say when you calm that body down, your pain is not going to go away, but you'll turn that dial down, and you can see it in your head. You can actually see it coming down, and then that gives that locus of control back a little bit. So you have some control over your life. So I think it's really important. And for those that want to understand how their body works, you don't need to get all sciencey, but you can let them know that your nervous system is the main driver of your pain, and you can have some effect over it.
Yeah.
I know back in
Keith.
the day, I've never really got. I don't. Mindfulness is sort of pretty much a new kid on the block when I first started for pain management, etc. That was it was well, no. On the pain management program, they wasn't doing it, but it's sort of. I think it's. Correct me if I'm wrong. It came around in the sort of early 2000s, something like that. I'm not sure. And but I've never personally myself really, and I'm not saying anything against it, but I've never really connected with it. But for me, I know that if I get uptight about anything, I've used an acronym that I was taught with another health condition I live with. It's called the halt sign, you know. Don't get hungry, angry, lonely, or tired. If you get any of those, halt, stop. You know, do something about those, like, you know, because I know what any of those can actually, uh, especially angry and stressed, that can wind the pain up, like, you know. And so that's for me. That's what work seems to work for me. But I've got in the latter years. I've been into. I've never really understood about meditation until I was listening to just by accident something on a social media, a Tibetan monk. He talked about the monkey mind, chatter, 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 you know, and he said that with a monkey you have to give it a banana. Well, you can't give it; it's in your mind. You can't give it a banana, but so you have to give it something to do. And he talked about so to give it something to do was just to concentrate on breathing in, breathing out, breathing in, breathing out.
Mhm.
And I'll tell you what, that's so helped me over the years, especially if I've had any procedures like I remember having an MRI scan, and you always keep thinking that lunatic outside banging on the outside of the drum and whatnot. And but I used that. I just kept breathing, just concentrating on breathing in and out, just the breath. And because he said that is, as a form of meditation. So, and I sort of stick with that, and but getting stressed out is like a luxury I can't afford really, because it just tightens things up, tightens the muscles up, and etc. Being angry again tightens all the muscles up, and I need to. For me, I need to my mind needs to be in neutral, so I've got a clarity of stuff to do and what not to do, etc. But anyway, that's my thoughts on it. Anyone else? No? Shall we move on to the next question? Nothing to add, Dershnee, or should we just move on to the next question?
Only just to say that I think for me, there's like a continuum of mindfulness. It goes from 0 to 100. So there's lots of ways in which to practice mindfulness. And meditation is not, I think when you speak of mindfulness, a lot of people think, well, it's meditation. And if they can't meditate, it's not going to happen. But exactly as you said, it's just breathing in and out. Sometimes it's just paying attention to your breath, and people and people are like, oh, so I always introduce mindfulness to my patients and clients in a very simple way, because I think that people need to understand there are various ways to be mindful. You can find what works for you and what fits for you. It's exactly Dave's point. If someone's here, doing it here, and you here, it's not going to work. So it is about meeting our patients and clients where they are, but in order to do that, we need to understand where they are,
Where they are. Yeah.
Okay, the next question is from someone called Violet, a healthcare professional. And she says, so how can we encourage teamwork between patients and their healthcare providers in managing pain effectively? I think personally, there's got to be a teamwork. There's not. I've only met with a couple of people who've had I suppose, the impetus to sort of do things. Always remember a mate of mine, Ed, from a gym I used to go to in Colchester in Essex, and he had back pain. I said, what? Because I was always interested why people go to gyms and stuff like that. And I said, why'd you come to the gym? He said, oh, I started getting back pain, so I better go to the gym. And I just said to him, man, you're weird, because normally people take themselves off to see the GP, get in medical model cycle and stuff like that. But Ed from the get go knew that he was that's how he managed his pain, going to the gym, etc. But teamwork is paramount, really, especially for people with long term pain. It goes back to being a. I don't think it should be like a marriage. So I often meet people. Oh, I'm going to go and see my osteopath again, or my chiropractor, or a physio again, or something. It's like if and I also it's not a marriage, mate. It's not till death do us part. there's got to be a point where you've got to, it's like permanently taking driving lessons sort of thing. They don't happen. You get to, if you've got the knowledge and skills, there's things that you can do for yourself. Like, I mean, I'm not beating my chest here, but I've not seen anybody about my pain for donkey's years. I can't even remember the last person I saw about pain. Um, I think I hired a physio when I got diagnosed with cancer. That I wanted to, was there any exercises I needed to do, but it turned out they were pretty much the ones I was doing already, and they was all pretty yoga-ish, and I was doing all that sort of stuff, but so, but I've just worked it out. I guess the pain management program gave me the skills, the knowledge, and confidence to do stuff, and that's what I've just carried on doing, really, So, but I think the teamwork is, especially in the early days, is paramount. You can't, but the healthcare professional has got to realise that not to keep them, it's to let go of them. Lee, listen, Pete, or Fred, you've got the skills, and you need to be doing this yourself, sort of thing.
Yeah, in the background, I've got the Wimbledon final on, and it just made me think whilst you were talking, Pete, that the person with pain is the player, the coaching team is the healthcare professionals, so they can give as much advice and information and techniques and everything else. But at the end of the day, when they walk out onto the court, or you walk out of that surgery or that appointment, it's all on the person with the pain. So it goes back to what we've said in answer to the first question today. You've got to meet them at their right level, and then let them start to lead. So, when if someone with pain comes to you as a healthcare professional with a problem, ask them how how they think they can solve it, because they might have an idea, and then between you can fine tune it. But if they get in the habit of every time they've got a problem, they come to you and you give them a solution, they're going to be reliant on you for the next however many years. Now, that's a great business model because they're going to keep coming back to you. You're going to keep getting the fees, but you're not going to get the referrals and then pick up the extra clients because that you've done a great job and freed that person up. I still see a chiro once every 2 months. But when I was having treatment with him, he made me a bet for my third course of treatment, saying if it hasn't made a difference, I'll give you a refund for that payment. And it did make a difference. However, I found that if I go and see him every 2 months, my pain is reduced a bit. And if I leave it for 2.5 months, I notice the difference, even when I'm not keeping track of when my appointments are. Because until I get the text from him on a Friday saying your appointment's Sunday, don't ask, he works Sundays. I forget that I've got another appointment. But then when I sit back and reflect on how my body is, I'm like, oh yeah, I am actually at the point where I need it, but it's not the thing that's driving me day by day.
Thanks, Dave.
I'm really interested in your thoughts, Dershnee, only because I think this is the whole concept of supported self-management, but it goes back to can't blame the healthcare provider if we only train them with the hammer.
Yeah. So my response to this question was very much going back to the listening. And the fact that we need to put our patients or clients in charge of the process. And if our patients and clients are in charge of the process and we're the teamwork happens automatically, because we're listening to our clients and our patients. But I think that what the healthcare system and the healthcare providers can do better is we need to be available for follow-ups. We need to make ourselves available when our clients need us. Because I think access to healthcare is problematic, and I think access to healthcare is problematic globally. It's not a problem that we only face in South Africa. I think it's a problem we face globally for people with persistent pain, is actually getting access to the right healthcare providers who are going to actually help us, as opposed to the people who are interventionists and who want to do surgery and needles and whatever else it is that they're offering.
Yeah.
So for me, my biggest problem with the teamwork approach is actually finding the right healthcare provider and
Mhm.
then that person listening to you.
Mhm.
Yeah.
Yeah. Love it. Yes.
Yeah,
Mhm.
and that's a very, very good point that, chopping and changing your healthcare professionals isn't a bad thing.
Yeah.
You've got to find the patient's got to find someone that they resonate with. And if you as a healthcare professional can't relate to that person because everyone's different and some people you just don't gel with,
Yeah.
push them on to somebody else or refer them to someone else so
Yeah.
that they can hopefully find that right relationship. Because it goes back to the tennis. How many times do the top players chop and change their coaches, their physio, their fitness coach? They are changing to find what works for them at that point in time.
Mm.
Yeah, I agree with you completely. And there's nothing wrong with that. I think I find that unfortunately, often that patients and clients don't want to seek second opinions. They don't want to, they get a bit dependent on the person that they're seeing because they're worried, that going to someone else might reflect badly, they don't,
Right.
especially if they have a relationship with the first person, they don't want to upset them. But
Mhm.
the other thing is like, well, what is this other person going to do for me if I'm already seeing a doctor?
Right.
So it's really about understanding the pain experience again. It always goes back to that, right?
Right. Yeah.
Keith,
Yeah.
what are your thoughts, mate? Because you've been quite quiet on this one.
Well, no, I think you guys have summed it up just wonderfully. I mean, to me, it is about truly supported self-management. And your comment you made early, Dershnee, about, if they're only trained with a hammer, then then everything's a nail. And so I look at it from a broader, like, and this is a systemic change that has to happen. We have to get right in at the beginning of healthcare providers' education at day one, teach them what like true supported self-management is, because we all too often our healthcare providers are trained as fixers, and when they can't be the fixer anymore, they don't know what to do, but they do have a lot that they can do, and everything that Dershnee has said is with being the validator and the listener and the supporter. So they need to understand that when the hammer doesn't work anymore, because there's a time and a place for the hammer. Don't get me wrong. I mean, I had surgery because I was badly broken in a car accident. I wanted a hammer. I didn't want somebody talking to me. But then after that, let's put the hammer away and let's talk about these other things. So to me, it's about systemic change, and we talk about that a lot. And it's getting them to understand that it's not all about interventions. It's about listening, meeting people where they're at, and helping them regain function. So, yeah.
Well, got a couple of more questions, but I'm going to hold off on those because we come to end of our time.
Holy smokes! Wow.
Yeah, I know. It goes really when you're enjoying yourself, etc.
Yeah. Wow.
That's what I thought of when we started doing a big podcast, just keeping it half an hour because I think, I was watching a podcast yesterday by
Yes.
a couple of dudes, and I felt it was going on forever, and I think it's nearly an
Yeah.
hour.
Mhm.
Yeah.
I'm not probably me. I've got a short attention span, but I thought
Sure.
they just go around the houses. But anyway,
Yeah.
it is what it
Yeah.
is.
Yeah.
Mhm.
So listen, I want to thank Dershnee for being a guest. Hope can you come back again to be a
Oh, I'll absolutely come back again. I love this discussion. It's been
well,
great. Yeah, and
Excellent.
I'm very
Awesome.
honored. I am also very honored that you asked me to be part of it. It makes me
well, you're
feel
one
really
of my
special.
Oh.
part of our family. Yeah,
Yeah.
Yeah.
I think the self-management family is it seems. I mean, there's a lot of notoriety now in self-management. I was watching posts that I still don't think healthcare professionals truly understand what self-management is. I think they're just sort of saying a word. I saw a post yesterday where they're using self-management and exercise, but there was just doing a paper on exercise, but they kept dropping in the word self-management. But they wasn't really identifiable saying, well, what part of self-management integrates with what they're doing, so
Right.
I
Yeah.
still don't think they get it. But
Yeah.
maybe me. But anyway, it's where they are, I guess. But yeah, I think anyway, let's wrap it up. Keith, if you can hang around, I want to have a little quick chat with you before you go on your journey. I want to talk to you a little bit about that. Personally, thanks very much for say coming on there. Dave, thanks very much for coming and joining us as well, and all the work you do on the academy. By the way, if you probably know it, but we run a Pain Toolkit Academy. We run courses on there for not only healthcare professionals, but people living with pain, both affordable, and also got conferences coming up. We got conferences. Dave said, I think I'm not sure, can't remember the dates now. It's all on the website anyway. You click on conferences. You see there's one in October for the European conference, and then the one in February. Name it. The day ago.
February 16th to 20th is the fourth International Pain Supported Self-Management Week. And then the conference is on the 21st. We're really excited about that one, aren't we, Pete?
Yeah.
It went over well last year, and it's only going to be better this year. So,
they just keep getting better and better.
18th of October, 9 o'clock UK time in the morning.
Love it.
It's not the middle of the night this time, so you know, I have to get up at 1:30 in the morning, unlike February. Which doesn't help pain management, by the way, if you have to disturb your sleep and change your sleep pattern.
Right. Yes. We hear you.
I know. I love doing all of them because I think about listening to other people out there, what they're doing around the planet, etc. Like, but I still think going back to we're still a small family. You know, if you ask me about how many self-managers I know, I'm going to struggle after I'll have to take my shoes and socks off, like, you know. But hopefully it's getting better. Anyway, thanks very much, guys, and take care, and we'll see you again next week. Take care. Ciao.
Thanks, everyone.
Bye.